I'm Ruth Ann, and by training, I'm actually a clinical nurse specialist. Currently, I work in a couple different capacities. I am a trainer at a program called Healing Hurt People here in the city, associated with Drexel. And I also have my own practice out a little bit into the burbs, Montgomery County. And I also do some training for the Sanctuary Institute. So kind of a number of different, keeps it interesting. Well, I came to that aha moment quite a while back when working in and coordinating a mental health unit. And the mental health unit was at a little Bucks County hospital up in Upper Bucks County. Where myself and a couple colleagues had the opportunity to really start up a whole program. And we did a great job. We had a terrific staff that we were able to bring on. And we had all these wonderful principles that we followed in terms of forming community, therapeutic community. And yeah, we did a good job. We had skill, and we had fun. And yet there were people coming through there that really seemed to elude our capacities to really understand what was going on and make a dent and a difference. And we wanted to. And I think, among other things, one of the people who I encountered, I'll never forget this because I encountered her in the ICU, little ICU in the hospital that we were in. A young woman, maybe 5 or 6 years younger than I was young then too. And she was there having made a very serious suicide attempt. And she was the mother of 2 young kids, 2 young daughters. And here's the way it went. She had shoplifted dolls for her 2 daughters. And probably really didn't need to shoplift. She had money, not a lot, but enough. And later she told me she was drawn to the dolls and she wanted her girls to have them, and she just took them. And she got caught, and she got charged, and she was ashamed, appalled at herself, and really ashamed in front of her daughters. This all went down. So she tried to kill herself. And what happened, what kind of poured out of her as she was telling the story, was about her background and what had happened to her, basically, is what she was telling the story. And she had been abused physically, sexually for years, from age 5 on. Her daughter was 5 at the time that she had this incident and made the suicide attempt. And the abuse was at the hands of her father and her mother. And, you know, so what struck me was that here was somebody who seemed in many ways like emotionally okay. Like she had this decent marriage to a good guy. She was raising these 2 beautiful little girls, and yet she tried to kill herself. And so as we talked a bit, she came down to our unit from intensive care. As we talked, what really poured out was the incredible shame, some of the rage, and a lot of the sadness related to her childhood and her fears about her kids. She didn't want to hurt them. Of course, she had in this suicide attempt. So my aha moment had to do with beginning to really connect that even though the diagnostic manual that we had at the time, I couldn't quite, you could fit her into a lot of different categories, but they didn't really match. But what did match was this had been a young woman who had been incredibly harmed. And it was kind of like, I didn't know the words at the time, but it was as if she was redoing what had happened to her, at least at the emotional level. And that was when, and that kind of collided with my colleagues' attendance at a training about trauma that happened about mid-80s, I think. And so the information started coming in from the stories of the patients, that we called them at the time, and the trainings that were going on. I really do think that I've been able to help facilitate some change. I think what's happening and what has happened in the city of Philadelphia is kind of like that little bit of a spark was lit many years ago that started to be fanned by a number of people in the city coming together from a lot of different directions. One of them that I think I really had some impact within was when Department of Behavioral Health and the Department of Human Services and the Housing Department in Philadelphia all kind of came together under leadership that's no longer really there at the heads of each of those different elements of the city, but is still kind of promoted by the head of DBH, that they really recognized that the things that happened in terms of violence and the way that communities seem to be, you know, Philadelphia's a city of communities in many ways, neighborhoods and communities, and I've been working in those neighborhoods and communities since the earlier 70s, when I did community mental health, that they were kind of seeming to come apart. And that when they got some information about the effects of what happens to people on people, or they got some trauma-based information, as we would say, they decided that they wanted to share that information across many of the areas of the city in terms of behavioral health, housing, human services, to see if there's some way that people could begin to get on the same page and try to help people within the city. And I was fortunate enough to be one of the trainers who trained all three of those sort of departments and shared knowledge that we'd acquired maybe for the last 20 years or so about trauma and its effects. And in that process, I really started to learn about the need to bring the trauma-based knowledge that we had acquired. We'd acquired it at a mental health individual level. Then we'd had a kind of a awareness that started to rise, particularly as Sandy Bloom started to do her work and do her writings about Sanctuary, that the organizations and the people who were delivering services were also impacted by adversity and stress and trauma. And once I got to doing those facilitations of trainings in Philadelphia, it became clearer and clearer to me that no matter how large you expanded the circle, when you got out from the person to the organizations and the staff to the communities in the city, the story was sort of the same. And you needed to understand the impact of trauma and adversity on communities, because they're made up of people who react pretty much similarly across the board to trauma and adversity and stress. So that's where the impact started to be made, I think. I think in trying to make an impact, I think I've encountered both support and resistance. You know, people, in order to understand things through the lens of trauma, you have to change the lens. And I think, therefore, in some ways, we came to understand that, people may not be as resistant to change as they are resistant to loss and letting go, and that comes with change. And so the resistance has come more from the way in which people, I think, they're used to doing things and seeing things in a certain way. Maybe their training has taught them about that. And so when you ask them to change the lens, and it really does change everything when you change to a trauma lens. Your perceptions of yourself probably are the primary ones that it changes. So I think people resist that and don't want to give up what they have become familiar with. And when it changes everything, I mean everything. It has to impact change not only for the people who you're trying to serve, but it also has to change you. It does change you if you really allow yourself to embody it, And I think that people resist that. Certainly organizations resist that. And at times, I think, whole cities resist that, Now, the support, on the other hand, for the work has also been, I think it's sort of unparalleled in the country. Because we do have people who are policymakers, who impact all different kinds of services, from the educational services, the police, the legal community, the behavioral health community, the housing community, certainly those who serve children, and really the informal community leaders. I think the best thing I've ever heard from anybody about the trauma-informed framework and lens is, oh, that makes sense. And it's so simple, but it really, I think it's true. I think other people have found that to be true. And frankly, there's a lot of things that we do in service delivery that don't make sense, that just doesn't bring everything together. And the trauma-informed principles and practices and awarenesses bring things together. It makes sense. So there's been a lot of support within Philadelphia as well. Some of the most valuable lessons learned here in Philadelphia that you would hope that people could learn, take a page from your book and learn from your book, is that you need to really respect that idea about people having a lot of emotional response to letting go of familiar ways of thinking about things and familiar ways of delivering services, that's going to be primary, and that if you don't find ways to name it, identify it, help people understand that it's not a shameful thing to have, that it's an expected thing to have, and that they can kind of ride that wave and get through it. I think unless people know that really from the get-go, your efforts are going to be far less successful. And I think that one of the things about that we learned here in Philadelphia is that you have to hear where people are coming from to begin with and what their thought. You have to listen to what their thoughts are and what their practices are, and maybe even help them figure out how they develop those practices, so that you can then give them an alternative that they can sort of weigh up against what they have been doing and see if they can come to the notion that, well, yeah, maybe what you're giving us in terms of understanding really does make sense and may really help us shift for ourselves as well as for the people that we serve. Another lesson is you have to get the right people to carry the information and the message. And that means you have to have a whole bunch of different people come to the table. Yes, you need leadership of major city organizations. You do need them. Because I think that their stamp on things really does matter. And if they don't stamp it as approved and not only approved, but you know what, we're going to follow this too. It's not just for you, it's for us too. If they don't put that stamp on it, it's not likely to go. But they are not by any means the only people that you need to impact change. You need people at all, you need a really diverse group, and I mean across delivery services, across gender, across race, across age. You really need to try to get a leadership group who can kind of then go out prongs to their constituency and bring the information and translate the information so that their constituencies, whoever they are, can begin to hear it. I think Philadelphia is ahead in terms of their awareness. You know, and I know there's been a kind of an attempt by those of us who are studying in the field to understand the differences between awareness of trauma, real sensitivity to it, so that, you know, you begin to not only kind of know it at the head level, but you begin to feel it and change or get ready to change because you feel it. And then, you know, we've come to call trauma responsive, where we are actually trying to make the change based on what we understand about trauma. And then I think the trauma-informed is when you really, I would say, embody it, you know, that your practices are such and your person is such that you kind of do your best to live the principles, which is not an easy thing to do. But I think Philadelphia is probably, they definitely are trauma aware, and I think increasingly trauma sensitive. And I think certain segments of Philadelphia have begun really being trauma responsive. So what I'd love to see is the city could actually embody it, you know. And so the next steps to that, well, I think it's really got to get out into the communities. And so next steps for that is to do what we can to understand how that can happen. And I think that can happen on a lot of levels. In the program that I work in at Drexel, the Healing Earth People program, there are people who receive the services from the program who embody it. And they go out to families, and they go out to neighborhoods, and they go out to friends, and they bring them in sometimes. But they, I think, carry the information at that level. And then I think we've got to get more and more of the community leaders to understand what we mean about trauma and adversity, and that we have to learn from them what their needs are in relation to trying to affect change in their own communities, you know. And what I'd like to see is I'd like to see Philadelphia eventually get to a real city of communities that kind of, they can all be pretty distinctive, because I think that's very important, but I'd love to see them come together kind of with the threads of the trauma-informed principles and practices, kind of knitting them, joining them, together. Well, yeah, one of the things I wanted to say, I think, is that the other thing that I think is really important about the trauma-informed knowledge base is that it brings together what I am so excited about and wish that I had a whole career to do over again because of. I really would love to have another career that would bring in all of the explosion of knowledge about in the neurosciences. And, as a nurse, I have a kind of an interest in that piece of it. And I think in my practice, what has helped so many people reduce reactivity and shame in relation to ways in which they behave has been to come to understand a little bit about how we as human beings respond to adversity. And I just want to be able to communicate to future leaders and people that are going to be working within communities and cities that knowledge base translated so that people really get it in terms of how it affects them is the thing that I think is going to be a real key piece. Because I think there's been so much reactivity and shame and anger in response to what's happened to people. And if we don't get off of that reactivity, polarization, soon, I worry about the future of cities and people in general. I feel like the capacity to create peace, love, and understanding could really be assisted by that idea about how you translate the knowledge base, brain-based knowledge even, into practice. So 10 to 15 years from now, I may live in Philadelphia, but I may be on the other side of the country. But I'd be coming back to visit Philadelphia because it's really my adopted home. And so what I would hope to see and hear, I'd hope to hear fewer, or if I really went for the gusto, no gunshots. I'd hope to see and hear a city that was filled with a lot more joyful noise, and I'd really like to see a city that was filled with more, really like beauty, like aesthetically pleasing things that would signify that people had joined together and, created community in lots of ways, including the physical space. Dreaming big, I'd like there to be fewer divisions. I'd like there to be a way that the city could use this information about trauma to increase their regard and respect for difference, and maintain differences, because I would hate to see, the ethnic, racial elements get too homogenized. I'd like to see them, remain distinct and celebrate culture, but be able to not do it at odds with each other, what else I would like to see if 10 to 15 years from now would be, I'd like to see Philadelphia be kind of the center of knowledge about this work.